There.
Dispatched for a 74-year-old male patient complaining of chest pain. Arrive on scene, see a pale diaphoretic gentleman who's holding his chest and appears to be conscious as we approach. I'll introduce myself and we'll go from there. Hi, my name's Matthew, I'm a paramedic. What's going on today?
Just not feeling good.
Just not feeling good.
Yeah.
Okay, what was your name again? George. Okay, when did this start, George?
About half an hour ago.
Okay. Did it come on all of a sudden or just kind of gradually?
It came on when I was shoveling.
Okay.
I was shoveling for about 10 minutes and I started to get this like a acid indigestion type of feeling in my chest. It's epigastric. I saw it on TV show once.
So it feels like a burning or a pressure or?
Yeah, like a pressure.
Like a pressure?
Yeah.
Like somebody sitting there?
Yeah.
Okay. Does anything seem to make it better or worse?
Well, it has eased up since I stopped shoveling, but
Okay.
it's still there.
But it's still there.
Yeah. Not quite as bad as it was.
Positionally doesn't seem to make a difference if you move around.
No,
If
I
you-
just can't get any.
If you
any
cough,
comfort.
you try coughing, does that?
No, I didn't try.
No change at all. And it feels like a pressure. Does it radiate? Does it go anywhere? Into your arm or into your jaw or?
Well, I thought I had a toothache since I called. It was kind of a funny feeling in my jaw.
Up into your jaw.
Yeah.
If you were to rate that pressure or that burning sensation that you're describing, what would number, if 10 was the worst pain you've ever had and 0 being none, what would you give it?
Well, I'd say it feels like a 7 maybe.
Okay.
But it was worse when it first came on. It was like
So
almost unbearable, almost a 10.
10 at first, and then with rest it kind of settled down. Okay, so it started 30 minutes ago with some exercise. It's pressureful, 7 to 10, it radiates up into your jaw. Anything else I'm missing about your symptoms that you have? You have any shortness of breath or anything like that?
I was a little nauseated
Okay.
whenever I had the initial heavier pain, but not as bad now.
And just, are you a little bit nauseated now?
Yeah, a little
What
bit.
number would you give that?
Maybe 2.
Do you have any allergies to any medications? Danny's just going to get a full set of vital signs. He's been plugging away there behind us, and
Do you want me to hook him up to him?
yeah, and then just click him on the monitor so that
I'm allergic to penicillin.
penicillin
Yeah. And bee stings.
and bees. Are you on any medications?
I'm on a pill that's for my heart, yeah.
Oh, do you know what the name of that heart pill is?
Starts with an M and it's long.
Metoprolol? No.
Metoprolol, I think it's metoprolol. Metoprolol, yeah. They just said my heart was going a little bit too fast and this might help to slow it down. And my blood pressure was up too. So
High blood pressure as well.
yeah, apparently. I
Just
don't
that
know.
one pill then? Did you say?
Yeah.
Just the one pill. Okay. As far as your past medical history, do you have any history of anxiety or anything like that?
No.
No? No?
I have insomnia.
Insomnia,
Yeah.
but never
Go to bed
never
and I
tend to
can't
get
stop.
pain in your chest or anything like that from feeling anxious or anything?
No.
No?
No.
Okay.
I've had butterfly feeling in my
Okay.
chest. I'm getting
Okay.
anxious.
Have you ever never been told you had stroke or mini strokes or seizures or anything like that?
No.
No. What about your heart? You said that you've been told that you had high blood pressure and that your heart rate was going a little bit fast?
Yeah, it was going a little fast and they thought that if they tried to slow it down, it would help with my blood pressure too. And I've been feeling good since I started that medication probably 3 months ago.
3 months, okay.
Yeah.
Has anyone ever told you you have angina or had heart attacks or anything like that before? Have you ever taken
No.
nitroglycerin? under
No,
your
I've never
tongue?
taken nitroglycerin, no.
And you don't take ASA every day or take a baby
I
aspirin?
take ASA every day, yeah. My doctor said I should take ASA just to be safe because I'm 70 something.
Okay. Have you ever been told you have heart murmurs or anything like that? No? Are you a smoker?
Well, I used to smoke, I quit last year, been smoking for 20 years.
Okay. How's your exercise?
Doctor's
Do you,
suggestion.
how many minutes a day would you walk?
I like Netflix.
Don't walk a lot?
I
so
don't
where
walk
do you
a
sit?
lot. I walk to the fridge and back.
Okay, do you have diabetes?
No.
And we're over age of 65. We'll say that our patient is moderately obese. And do you have a history of high cholesterol? No one's ever told you that?
It was mentioned, but they never put me on any medication yet. Or they were just gonna monitor it. Yeah, they were just gonna start to monitor, how things are, they're talking about maybe in the future. I might have to take some meds for that. Just change my diet a little bit.
Okay. Do you have any family history of cardiac problems?
Well, my father died when he was 90
Okay,
of a heart attack.
okay. And have you had any excess stress or drinking any, or do you have any excess stress lately?
Yeah, money problems, you know.
Okay. Are you a
drinker?
drinker?
To pay Paul, that type of thing.
Yeah. Are you a drinker?
I like a couple of beer a day.
Okay. How many drinks would you drink a week?
7 times 3, 21 beer a week. Is that a lot? That seems like a lot.
Okay. When's the last time you were to your doctor?
I don't get drunk.
Okay.
Doctor was about 6 months ago. That's when I
6
talked
months
about
ago?
maybe, no, that was 3 months ago. I was putting on the medication then, yeah.
Okay, 3 months
3
ago.
months ago.
And do you have any ongoing medical tests? No.
I'm
Nothing
supposed to
you're
go in
waiting-
and do a stress test.
Supposed to go do a stress
I didn't
test.
get there yet, so. Storm came up and I missed my appointment.
Gotcha. Okay. I'm just gonna give you a check over if that's all right, and see if we can figure out, Danny, what do we got for vital signs?
Everything but
Heart rate 78, SATs 98. Can you do a 12 lead? We'll not actually have you do that, but we'll just say that's ongoing. 99.
Are those good?
Respiratory.
Are
They
those
look
numbers good?
lovely. You
7
are
8 seems low.
you are just fantastic. Despite that we're more concerned about this chest pain, but your vital signs all look stable. And blood glucose is 6.8 and temp of 37.6. Okay. I'm just gonna shine a light in your eyes if that's all right.
Certainly.
Just look at
Sorry, I'm gonna call somebody.
No, I was gonna text, but I would get in trouble for doing that at work. Yeah. I'm just gonna flip your eyelid down and just see. Okay, nice and pink. Can you stick your tongue in for me? Nice and moist. Close your mouth. No centralized cyanosis. Can I just get you to turn your head to the side? Okay. I'm not at a 45-degree angle, but we have no evidence of any jugular venous distension. Trachea is midline. Pain in your chest. Can you point to where it is right now?
Right there.
Right there. Yeah. Right there. Does it hurt at all if you push on it?
No, it doesn't make any difference. Really.
So I'd expose George's chest, have a look at where the area of the pain, and let's say there's nothing there at all. And you said it doesn't hurt if you cough or take a deep breath?
No, it doesn't make any difference.
Doesn't make any difference. No difference. Okay. Just take a nice deep breath for me. So nice, good, nice. Whoa, nice. You're getting pretty relaxed there. Nice and symmetrical.
Massage it for seconds. Yeah.
Just gonna listen to your lung sounds if that's all right. Okay, if I untuck your shirt here.
Oh, sorry.
In and out through your mouth. And out. Okay, you just breathe nice and easy. I'm just going to listen to your heart sounds if that's okay. section palpation. I can percuss, but he doesn't seem like he's got, I'll just percuss into his armpits. But I don't think there's all that much here. He's not sure about it at all. Any pain in your abdomen at all? What if I push in on here up in your upper gastrum? Does that cause any changes?
No.
No, nice and soft. Maybe when we get you up in the stretcher, we'll try and see if your liver. Just going to come down, no incontinence, come down his feet, flip his feet. No pedal edema. 3 seconds cup refill. You can feel me squeezing your leg. Which leg am I squeezing?
Left. Right.
Can you push down on my feet, or my fingers, and pull it? Your fingers now that we got you all tied up. And I'll just feel as close as bilateral. Just gonna come up and feel this. Thank you for a second. I don't feel any thrills or anything. That's regular. Okay, so we have our 12 lead now. We'll just say that our 12 lead has SD elevation for the time being. We'll go back to main screen. I'll put it up here so you can see it for the sake of time. Okay, sir. We have some findings on your cardiogram and also your chest pain. We're just concerned that you might be having a heart attack or something of that nature. But we're going to take you into the hospital and get some other things. Just as I'm talking to Danny over things other than, the reason why, Danny, that I think that he might have an acute coronary syndrome, his chest pain is very typical for acute coronary syndrome. He has some cardiac risk factors as well as cardiac medications. And he's got positive ST elevation V1 through V5. So he's got a fairly good size and lots of ST elevation. And reciprocal depression into the AVF. Seems those are the reasons why I think he's having a heart attack right now. As far as things else this could be is pericarditis. You haven't been sick in the last few weeks, have you? Had any colds or flus? Nothing like that?
I had the flu 3 weeks ago.
3 weeks ago? But you haven't noticed that pain changing at all?
No.
When you move, doesn't hurt
Doesn't
hurt anymore if you lay back or change at all when you sit up or anything like that?
I couldn't find any relief any way, shape, or form. It just seemed to go down from the original pain to where it is now. I can't get over it. But nothing helps.
Okay. So it doesn't seem, it haven't been running a fever or anything, and he's not febrile now. No fevers, anything like that? And his 12 lead doesn't seem to have pericarditis. Thoracic aneurysm, you said this pain didn't come, it didn't come on, it came on gradually, not suddenly. Kind of came over a few minutes, not like a light switch.
Not like a light switch, no. It
Okay.
seemed to be kind of a gradual thing.
Do you feel any tearing into your back or anything? No. Into your shoulders? Yeah, if you don't mind just taking the blood pressure in his other arm, that would be lovely. Just to see what they have there, just to see that we don't have any difference. As far as you haven't had any recent travels thinking about pulmonary embolism, haven't been traveling for long durations anywhere?
No.
No?
Just watching Netflix.
Just watching Netflix. Okay. No pain in your legs anywhere? No, nothing. And you take that aspirin every day pretty faithfully? Okay, it doesn't sound like that. Are you prone to? I forgot to ask you any questions about your intake. How's your appetite been lately? Good. Have you had any nausea previous to when the chest pain started in the last few days?
Been fine.
Good appetite.
Yeah.
And not prone to getting.
Well, when I had the flu 3 weeks ago, I had nausea.
Yeah. Not prone to getting acid reflux or gastric.
No,
reflux?
I've never had any problems like that.
Nothing like that? Okay. Okay, doesn't sound like, and no history of any ulcers of any sort, peptic ulcer or
No.
esophagitis. Okay, so it doesn't seem gastrointestinal at all. So treatment plan, what we're going to do for him, Danny, is we're going to give him nitro, 0.4 milligrams. We know you're not on any erectile dysfunction medications. Don't take any of those medications?
No.
No. Cialis, Levitra, Viagra, none of those. Really important just that we know, because this medication can interact with those and cause you a really low blood pressure. But if you're sure you haven't taken any of those in the last 48
Sounds like a
hours,
Beach Boys song though. CLS, Levitra.
babe, it sounds very, very much so. That's I haven't heard that one. 48. Okay, so and have you ever had nitroglycerin before?
No.
A spray on your tongue. He's got no known allergy to it, and his blood pressure is 126 on 87 in both arms. So no difference between the two. So we're going to give him a spray of nitro every 5 minutes. You can go ahead and give him a spray. Prime first, and yep, we'll prime it first. Give it a couple sprays. There you go. And then we'll get him to lift up his tongue, spray it under his tongue, and he gets 0.4, making sure that the drug's not expired and noting our time. Then we're going to go to our aspirin. You don't have any history of any bleeding anywhere?
No.
Have never noticed any blood in your stools, a coffee ground kind of appearance to those or anything? No? And no history of asthma? No? Okay, we're going to give you 160 milligrams of those aspirin. Instead of like when you normally take your coated aspirin, these are baby ones, so they're orange flavored. You're going to chew them up and just swallow them, okay? So Danny will give you 2 of those pills to chew up and swallow. And Danny's been so kind as to start an IV in his hand, so we have IV access. How nauseated are you feeling right now?
I don't think I'll throw up. I just feel, in my head feels a little spinny and lightheaded, that type of thing.
Okay. Well, you let me know how we're due. I think what we'll do is we'll get you on the truck and we'll get you over on our way into the hospital because we're going to get you there quickly because I think you're having a heart attack. And
You think I'm having a heart attack?
yeah, I do. Yep. I think
My
that that's
father died of a heart
I
attack.
think that that's a real possibility.
Oh.
But there's some other things that could be causing this, and we'll just get into the hospital and have some other tests, and we'll find out for sure what's going on. But I think we better make our way there quickly. Okay? Any questions, concerns? You fine with all that?
Am I gonna be okay?
We'll do our absolute best for you. You're doing your vital signs.
Am I gonna die?
Your vital signs are all stable right now. I think you're going to be fine. Dana, am I missing anything?
No.
Okay. That's it.
Somebody might ask